My biggest goal, I'm not an art therapist myself, but was to communicate with other providers how beneficial it can be to the patient by adding other perspectives into the multidisciplinary team. So my partner who is involved in that, she's an accomplished art therapist, and when we brought her into the team, we noticed that there were other perspectives that were brought out. She saw the world through a different lens, and that just enabled us to have one more data point that enabled us to take care of the soldier that was in front of us. I see the world through my own perspective, and having other people on my team that can see the world from other vantage points gives me a better idea of the soldier that I'm taking care of, and that improves care. The art therapist, by bringing her into the team environment, would be able to tell us, you know, this individual was really engaged throughout the art therapy process. They were also including other people. They were social. She might say, you know, from the appearance of these creations that he's making after discussing with him or looking at the art, I really think this guy's a lot more depressed than he thinks that he's revealing to the treatment team. Disorganization can be an issue that can be revealed that might not necessarily be initially apparent to the treatment team, especially if they're very paranoid or guarded. That can be brought out. It's just one more data point, one more piece of information, and likely we would have gotten that information at some point in time anyway, but just getting that information sooner helps us to incorporate that into the formulation so we can take care of soldiers better. I think it applies to anyone. I think the bottom line is the more people you have on your team, and inviting people who have different perspectives other than your own, it only enhances the outcomes that your team has. I'm not an art therapist, and I let the experts do what the experts do. From watching the process from not afar, but at least from an outside objective viewpoint, there are some soldiers that at times are hesitant to start, but especially in a group environment, they do. And just small steps, they can really get very involved in it. Any therapeutic modality is not for every single patient. So some patients, they just don't want to take medications. Some patients don't want to engage in traditional psychotherapies. There might be some patients that don't want to engage in art therapy, and that's okay. We just need to make sure that we're tailoring our treatment for the individual patient, or in my case, individual soldier that's in front of me. I think that there is such a thing as too big of a team, but I think that your team dynamics dictate how big your team can be. And your organizational structure and the leadership on the ward or whatever environment that you have, those can dictate what that final parameter is. Obviously, if you have a well-meshing team, it might be worthwhile to consider adding an art therapist on board and see if that facilitates information discovery in your specific wards or intensive outpatient programs, and if it actually also is a therapeutic modality that helps your patients. I think that you will, no matter where you are, you will get a safe standard of behavioral health care. Every single psychiatrist treats soldiers slightly differently, and that's partially because we had slightly different training, and also because we're different people. So what works for me doesn't if I tried to use one of my friend's approaches, it just wouldn't work. You know, so I don't think that you're going to get a cookie cutter type treatment if you go to different locations, but you will get a minimum standard of care. For an example, in PTSD, exposure therapy is one of the things that we do to help soldiers who have PTSD. And there are many different types of exposure therapies that soldiers can be given. My viewpoint is as long as they're receiving good quality care that is evidence-based, the specific care that they get, I would rather have a provider treat me with a treatment modality that works for that provider than be forced to use a specific treatment modality that doesn't. So I would say that you're not going to get the same care, but you're going to get the same quality or standard of care.